Hello and welcome to the channel Health Explained Clearly. This channel shares health knowledge, based on medical science, helping you understand health issues correctly, prevent disease early, and take control of your own well-being. In today's video, we will explore 7 warning signs that brain blood vessels are gradually narrowing, a silent condition that can lead to serious stroke, if not detected in time. Before we go into each specific warning sign, it is important to understand why the blood vessels in the brain become narrowed. Over time, bad cholesterol, blood lipids, calcium, and plaque gradually build up along the inner walls of blood vessels. This process causes no pain, no fever, and often goes completely unnoticed. However, the vessel lumen becomes narrower, and blood flow to the brain slowly becomes weaker and slower. Because this process develops silently, many people only discover the problem after a stroke has already occurred. In today's video, we will talk about 7 warning signs that brain blood vessels are gradually narrowing, a condition that progresses quietly, but is one of the leading causes of stroke. The danger is that brain blood vessels do not narrow suddenly. Plaque builds up little by little over time, and when clear symptoms appear, it is often already too late. If you or your loved ones are over 40 years old, and have high blood pressure, high cholesterol, or diabetes, this is a video you should not skip. The first warning sign is persistent headaches, usually a dull, aching pain, sometimes with a feeling of head pressure or heaviness, especially in the morning, or during periods of stress. This happens because the brain's blood vessels are narrowed, which reduces blood flow and oxygen to the brain, forcing the brain to work harder to compensate. Many people assume this is simply caused by poor sleep or stress, but if the headache keeps coming back for weeks, it is a sign that should not be ignored. When you stand up suddenly, you may feel lightheaded or dizzy, sometimes with temporary darkening of vision, or even feel like you might fall. This is not simply low blood pressure. In many cases, it is caused by narrowed blood vessels supplying the brain, which means the brain does not receive enough blood in the first few seconds. If this happens frequently, especially in middle-aged adults, it is important to consider narrowing of brain blood vessels. One important point to remember is that the signs of narrowed brain blood vessels do not usually appear all at the same time. Some people experience only headaches, others have only numbness in the arms or legs, and some experience only dizziness. This causes many people to underestimate the problem, thinking these are separate symptoms. In reality, they are different pieces of the same puzzle. Brain blood vessels that are gradually narrowing over time. Have you ever experienced sudden numbness on one side of the face, numbness in an arm or leg, with a tingling sensation, but the symptoms go away after a short rest? This may be a transient ischemic attack, often called a mini-stroke. The cause is narrowed blood vessels, uneven blood flow to the brain. A part of the brain becomes temporarily deprived of oxygen. This is an early warning sign of stroke, but many people ignore it because they believe it is not serious. Do you notice that you forget things you just did, read something but cannot remember the content, have difficulty focusing for long periods? The brain is extremely sensitive to oxygen deprivation. When brain blood vessels are narrowed for a long time, the brain does not die immediately, but its function gradually declines. This is why many people experience early memory decline. Even though the real cause is related to reduced blood flow to the brain, many people believe that memory loss is simply part of aging. This is only partly true. In healthy individuals, memory decline happens very slowly. However, when brain blood vessels are narrowed, the brain suffers from long-term oxygen shortage, causing nerve cells to age faster than normal. That is why many people, in their 40s or 50s, already show signs of forgetfulness, slowed thinking, and reduced mental clarity. Some people experience sudden blurred vision lasting a few minutes, double vision or overlapping images, then their vision returns to normal. The cause is narrowed blood vessels supplying the visual areas of the brain, which temporarily reduces blood flow to these regions. This is a very typical sign of narrowed brain blood vessels, but it is often mistaken for an eye problem, and therefore easily overlooked. You may want to speak, but your tongue does not respond properly. Your speech becomes slurred or unclear. The problem lasts for a few minutes and then goes away. This is a sign that the area of the brain responsible for language is not receiving enough blood, causing temporary speech disturbances. If this happens repeatedly, the risk of a true stroke becomes very high, and it should never be ignored. When it comes to fatigue, many people immediately think of lack of sleep or work-related stress. However, if fatigue lasts for many months and does not improve despite adequate rest, it is important to consider a problem related to brain blood vessels. The brain is the most oxygen-demanding organ in the body. Even a small reduction in blood flow can cause the brain to respond with fatigue, sluggishness, and excessive sleepiness. Even if you are not doing heavy work and are getting enough sleep, but still feel constantly tired and mentally drained, the underlying cause may be insufficient oxygen supply to the brain, due to gradual narrowing of brain blood vessels over time. The unfortunate reality is that many cases of stroke are completely preventable if warning signs are recognized early. Controlling blood pressure, cholesterol, and blood sugar, maintaining regular physical activity, following a healthy diet, and having periodic brain blood vessel checkups are not complicated measures. Brain health directly determines quality of life in the future. Do not wait until you experience slurred speech or paralysis of the arms or legs before becoming concerned. The most dangerous aspect of narrowed brain blood vessels is that it does not cause severe pain, it does not create dramatic symptoms, but when a stroke occurs, the damage is often severe. If you experience 2 or 3 of these signs, it is important to have your brain blood vessels checked early. Early detection allows for lifestyle and medical adjustments and helps prevent stroke and long-term paralysis. If you find this video helpful, please subscribe to the channel and turn on the notification bell so you won't miss future videos about health from a clear, scientific, and medical perspective. Thank you for watching, and see you in the next video.